But I'm going to start with this question for our panelists to really get the dialogue starting, and then of course I encourage you, if you've taken a slip of paper, to write down your question and we will address them. So the first one is, if 1 in 5 people experience mental illness in the US, what can we do to create a culture of support? And I'm going to sit down and join Steve here, join the panel, because I'm sure you may have questions for me. Steve, why don't you start us out?
Well, first of all, thank you, Ryan, for inviting us. And I think to answer your questions, I think it starts in a number of ways in events like this, right? I mean, it's about education. It's about erasing the stigma that's attached to mental health conditions, to substance abuse and addiction. It's all about people learning, particularly where I'm coming from with addictions, that it's a disease. It's not a moral shortcoming or a moral failure. And I think slowly we're moving to that acceptance in this country more and more. And it's part of the mission of Recovery Centers of America is to defeat that stigma, to make the treatment of addictions just as common as the treatment of cancer, the treatment of heart attack, diabetes, and any other medical condition.
Yeah, so true. I mean, the facility that he runs is extraordinary. I was able to get a tour recently, and I mean, it's so impressive that we have your resource and your facility right here in our community, and I encourage you all to reach out to Steve for more insight. Peter?
For us, very similar. It's about erasing the stigma. It's about helping individuals within our community understand the resources that are available to them, and also helping families to realize that it's okay to ask for help, and that no one should be ashamed of any ailments or addictions which they may face, but that we as a community must be able to face them together. And so really in my role as mayor, I work predominantly with our police force, and so we work diligently to ensure that our police are extremely involved in the community. People can see them as a resource, and they are kind of a trusted partner in helping to resolve many of the issues which we face as a community.
Great, thank you, Peter. Lauren?
Yeah. So I'll echo Steve's thanks for having us. You did an excellent job. Just again, who I am, I'm leading our initiative to help prevent and end homelessness in this county. Make it rare, brief, and non-reoccurring is the goal. And with that in mind, we absolutely recognize the need to assure that those experiencing homelessness have people to help address mental health challenges, because that's a vital part of being stably housed. And just a piece of this, a little background too. Of the about 1,200 folks we served last year, 30% of those self-reported a mental health condition, and about 24% reported having multiple conditions, so like a physical disability, drug and alcohol abuse, and mental health combination. So I'll again echo what you guys are saying. A huge piece of this is breaking down the stigma. Some initiatives that we've done in the past to help do this is putting out a photography display to just help tell the story of who are the folks that are going through this. And I always stress when I talk about this too that it's not an us and them piece. Two of my best friends struggle with OCD and bipolar disorder, and I know that if they didn't have the supports, the natural medical supports, and even the support of a home, I don't know where they'd be. So I think it's crucial to be able to advocate for that.
Thank you for sharing. Great.
Yeah, a lot of what I would say would echo what's been said so far, although I describe the approach a little bit differently. I would describe it as a matter of lowering threshold to access, and I think about that in both philosophical terms and more kind of pragmatic terms. So philosophically, at the VA where I work, we really aren't buying in too much to labels like addict or disease or things like that. They don't really matter so much if a vet doesn't believe that he or she has a so-called disease or is an addict. It doesn't matter. If they're living in a way that's so consistent with what they want for themselves, come on in, we'll help you. And I think pragmatically too, I'm talking about having lots of groups that open to people and don't require a lot of steps to get into. We get referrals from other providers, and I haven't processed that referral yet. We don't care. Come on up, there's a group at 9 o'clock every day. We'll take care of the paperwork later. Also, in terms of whether a person is still using substances or not, we have vets who are using substances and still coming up and getting treatment with us. It's likely that because they're with us, they're using less and are now on a trajectory to using them at all. So I'm thinking of it in terms of access to threshold.
And I do think that that's one of the biggest barriers. And I know, as I shared in my story, you know, I was very fortunate to have an incredible healthcare plan with the university and have the resources to take a leave and to, you know, go to outpatient treatment and understand what bipolar disorder is and get well. And thankfully, they saved my job because I was so invested in that community and also, you know, a member of the team, and it's part of life. But I did have incredible access to care, and that was essential. Jamie?
Well, that's a good time for me to come in because I do work for the county, and what our role is we fund uninsured and underinsured people for substance use treatment. We have over 70 contracted providers in the state of Pennsylvania. We have 5 points of access throughout Chester County, one of them right here in Phoenixville. So we want to ensure that people do get the services they need and make sure people know that services are available. You don't necessarily need to have insurance. That's absolutely what we're here for. That's what your tax dollars are for. And then we do multiple things in the community to include training, seminars, Narcan trainings. We've recently done a series of public service announcements. You may have seen them or heard them on the radio. And we also have prevention in the community. So we really try and get the information out there. We have 23 medication collection boxes throughout the county, and the purpose of that is to get the unused medication out of the household so it doesn't fall into the wrong hands, which may not always be the substance abuser. I mean, it could be a 5-year-old that mistakes a bottle of medication as Skittles, and I love to use this example because this looks so appetizing to a 5-year-old, and truthfully, when a 5-year-old looks at medication, this is really what they see. They see Skittles, they don't see medication that could potentially kill them. So just in 2017 alone, we collected over 10,000 pounds of medication. For any of you who have taken medication know that there's really no weight to most medications. So that's actually tons of medication that we've removed from households, and we consider that part of prevention. So that's a snapshot of what we do.